What is fever? Why do we get fevers? What does it mean when a fever breaks? Today at Citizen Surgeon, I'm going to break fever down for you. I'm going to teach you the difference between fever and hyperthermia. And if you stick around to the end, I'm going to teach you about that single molecule responsible for our set point. All right, let's do it. Welcome back to Citizen Surgeon. This is where you're coming to get more comfortable on your exams, on the ward, in the ICU, and of course the operating room. My name's Dr. Eric Pearson. I'm a pediatric surgeon, and I'm pumped that you're here. Today we're talking about fever. This is so important because fever is really common in surgical patients, and it should always be a cause for concern. And so the first thing to talk about is what is fever and what is hyperthermia? And what's the difference between the two? Fever is an intentional increase in our body's physiological set point in response to either exogenous or outside the body or endogenous or inside the body pyrogens. And we're going to talk about what those pyrogens are. So by increasing the body's physiological set point, we're able to aid the body's defense against invading pathogens. So how is that different than hyperthermia? Hyperthermia is just an increase in heat production or an inability to get rid of heat. So, for example, when you have heat stroke, you have an inability to get rid of heat because your surrounding temperature prevents evaporation, prevents heat loss. You can also have malignant hyperthermia, and we're going to talk about that a few different times. And that's a genetically or an inherited autosomal dominant condition where the body, in response to a particular trigger, has massive heat production. And when you get above 104 or 105 degrees, it can become fatal. So fever and hyperthermia are really important to understand. But the first step I want you to get to is fever is not hyperthermia. Hyperthermia is increased heat production or decreased heat loss, and fever is a physiological change in the body's set point. So let's get to some numbers. So whenever we look at data, we want to know where that data is coming from. And data for temperature comes from a long time ago. So back in 1870, there's this guy, Dr. Wunderlich. Now that's German, I don't speak German, so cut me a little bit of slack. But Wunderlich looked at 25,000 or so patients, and he studied axillary temperatures. And he discovered that not only does the temperature in normal people fluctuate throughout the day, but temperature should be thought of as a range. Now he came up with the number that we associate with normal temperature, and that is 98.6 degrees Fahrenheit. He also came up with a number that we should be concerned about for fever, and that's 100.4 degrees Fahrenheit. So when your temperature is above 100.4, you could say that this could be a fever. So when we're talking about fever, we also have to talk about heat or thermoregulation in the body. So in the normal body, how do we stay warm? Right? Have you ever asked yourself that? Well, we stay warm for a bunch of different reasons. Number one is through metabolism. So when we take glucose to form ATP, remember, for every glucose, we get about 34, 36 ATP molecules, depending on what book you read. Well, the byproduct of that is heat. All right? Well, also skeletal muscle contraction. So when you're on the Peloton or going for a run, that skeletal muscle contraction, that creates heat. Well, when you're cold, how do you create heat? Well, you shiver, all right? So you shiver, and shivering increases your body's temperature. Okay, so what about non-shivering thermogenesis? So non-shivering thermogenesis, this is something that babies or infants really depend on for heat. And that's because they have an increased amount of brown fat. So you can see here in the white fat cell, you have a big lipid droplet, you have a nucleus, and then you have a mitochondria. Well, how's that different from the brown fat cell? All right? Well, the brown fat cell also has a lipid droplet, also has a nucleus, but has tons of mitochondria. And these mitochondria are responsible for producing ATP, and those brown fat cells are responsible for non-shivering thermogenesis or more heat production. So this is common in babies and infants, but we also have increased deposits of brown fat. We have it in the neck, we have it near the shoulder blades, near the adrenal glands, and then of course near the deep blood vessels like the aorta that runs along your spinal column. So where is our body's thermometer? Well, our body's thermometer is in the preoptic area of the anterior hypothalamus, and that's where we have our set point. And remember, that set point is at 98.6 degrees Fahrenheit. So that set point is the guide that the brain uses to either warm us or cool us. So like we talked about, when it's hot outside, the body senses that it's greater than 98.6 degrees, but we need to cool ourselves down. So you can see in this heat-mapped body that we're gonna have vasodilation, more heat is gonna be spread to the extremities, and that's gonna cool us off. When it's cold outside, the body senses that we're dropping below 98.6. We need to conserve that heat, so we get vasoconstriction in our extremities, and that's gonna increase the heat conservation in our core. And so the big question becomes, how do we change our set point? So we change our set point through pyrogens. And I'm not talking about fireworks. I'm talking about molecules either coming from inside the body, endogenous, or outside the body, exogenous, that leads to an increase in our set point. So let's go through a pathway. So here we have some exogenous pyrogens. Now, exogenous pyrogens are things like bacteria or bacterial toxins or lipopolysaccharide, things that are going to stimulate us to increase our set point to fight off that infection or aid the body in fighting off that infection. So the first thing that happens is you have these exogenous pyrogens circulating throughout the body. Now, what are those going to do? Those are going to activate our leukocytes or our white blood cells. Activated leukocytes are now going to secrete endogenous pyrogens. And these are the four most important endogenous pyrogens. You have interleukin 1, interleukin 6, tumor necrosis factor alpha, and interferon gamma. These four molecules are responsible for increasing our set point. When those molecules travel in our circulation up to the brain, they are sensed by the anterior hypothalamus, the preoptic area of the anterior hypothalamus. And this is where we're going to have a couple of really important reactions and a few important enzymes to remember. And these are the targets of things like Tylenol to decrease our fevers. So the first reaction is phospholipase A2 is the enzyme, and that takes membrane phospholipid and converts it to arachidonic acid. Now the second reaction is by the enzyme cyclooxygenase, or COX, and that's going to convert arachidonic acid into a bunch of different things, but most importantly, it converts it into prostaglandin E2. Now, one of the things I want you to go study is the arachidonic acid pathway, but be careful because you'll definitely have your mind blown a little bit of all of the downstream products of arachidonic acid metabolism. But arachidonic acid and cyclooxygenase in particular are targets of our antipyretics like Tylenol. So it's really important to understand this pathway that I've made really simple here. Now that we have prostaglandin E2, what happens? And so the prostaglandin E2 binds to those EP3 receptors, preoptic area of the anterior hypothalamus. Those are GABAergic receptors, so you get decreased cyclic AMP, and that disinhibition, and so that leads to increased spinal motor outputs for heat production, for shivering thermogenesis, for tachycardia, and brown fat activation. And these are involuntary responses to increase core body temperature to aid the body to respond to that infection. And it's important to remember that a fever also accompanies the acute phase response. Now, we're not going to get into detail of the acute phase response. We've talked about that in other videos, but the acute phase response is a very complicated pathway where you get massive cytokine activation in order to respond to inflammation or infection. All right, so what does it mean when a fever breaks? So we're having this increase in our set point. We have our exogenous pyrogens activating our leukocytes, our endogenous pyrogens, those are IL-1, IL-6, TNF-alpha, interferon gamma. They're increasing our body set point to, let's say, 102 degrees. So once we get up to 102 degrees, we're fighting the infection. Our body is feeling comfortable at 102 degrees. We've stopped shivering, we've stopped feeling cold. We're up there, okay? But now we fought off the infection. And we no longer have those endogenous or exogenous pyrogens circulating in the body. So what happens? Our set point drops. Our set point drops back down to 98.6 degrees. But we're still at 102. So what happens? We have to start sweating. We start sweating because we need to cool off. And that's what happens when your fever breaks. When you're lying in bed and all of a sudden you're copiously sweating and wet, that is a fever breaking, and that's when your temperature is going to start dropping down because your set point has returned to normal. So last, I want to talk about fever patterns. Now, these might not always be helpful, but when you're doing your clinical examination, you might key in to a particular pattern, and that might help you make the diagnosis. So there are 5 different fever patterns. You have intermittent fevers, remittent fevers, relapsing fevers, and you have sustained fever and continuous fever. So what's an intermittent fever? An intermittent fever is when the temperature is elevated and you have a fever and it falls back to normal, and then it comes back. You can see this within an intra-abdominal abscess where you'll have a fever, it'll go up to 102, come back down to 98.6, 99, and then pop back up to 102. That's an intermittent fever. Well, what's a remittent fever? Well, a remittent fever is where you have an increase in temperature and it drops, but it doesn't return all the way to normal. It stays elevated. That's a remittent fever. Either intermittent or remittent fevers can be determined as hectic if the fever change is great, like greater than 1.4 degrees. So the example I gave you where it was 98.6 all the way up to 102 and back down, that would be a hectic fever. Well, what's a relapsing fever? A relapsing fever is where you have a fever curve or a fever pattern, but it's separated by days or weeks. All right, so that leaves us sustained and continuous. So a sustained or a continuous fever, basically the same thing, and that's where you have an elevated temperature and it just doesn't change. These patients typically don't get chills or rigors, and this is characteristic of typhoid, also characteristic of bacterial endocarditis, tuberculosis. Pneumonia can also give you this picture, and there are some non-infectious causes. So some cancers can give you this continuous or sustained fever. All right, we talked a lot about fever today. Let's summarize it all up. Okay, as we talked about with Dr. Wunderlich, normal body temperature is a range, but you can use 98.6 degrees as a normal body temperature and 100.4 degrees Fahrenheit or greater as a fever. Fever is an increase in temperature due to an increase in set point. If you just have an increase in temperature due to too much heat gain or not enough heat loss, then that's called hyperthermia, and these two are different. The body's thermoregulation, remember, this is a coordination between the environment, the brain, and the circulatory system. All right, well, I hope you enjoyed that talk on fever today. It is a simple but incredibly important topic. And the next video you're going to want to see, and that's going to be coming out soon, is post-op fevers. And that is an incredibly important topic if you're going to be going into surgery. All right, I hope you enjoyed this. If you did, give it a like, share this with your friends. If you haven't had a chance to subscribe yet, go ahead, subscribe, turn on the notifications. I'm going to be trying to put out a video every week on surgical topics. So if there's a topic that you want to learn more about, go ahead, hit me up in the comments, leave a comment. I love engaging with you. As always, be safe, study hard, and I'll see you next time.